A big pandemic promise from the governor. We're learning more about when the first round of vaccines could hit the ground in Arizona. Plus, how hospitals are dealing with a wave of new patients. COVID hospitalizations doubled this month to nearly 2,500 people.
Tonight, there are more than 2,600 new cases reported and 0 deaths. And a reminder for you, numbers tend to be lower on Mondays because of a lag in reporting. Our test positivity rate continues to stay at last week's at 12%. And as more people contract the virus, the more our hospitals are filling up. Right now, only 1 in 10 ICU beds is open. And that number has nurses and doctors pretty concerned right now.
Open beds aren't the biggest concern, it's staffing. Some hospitals might not have the staff to take care of all the patients in those beds. Brianna Whitney spent the day talking to a variety of staff from different hospitals. So Brianna, what's everybody telling you?
So I wanted to get a scope of what exactly the main concern is in hospitals right now. So I spoke to an emergency medicine doctor, a COVID-19 task force doctor, a nurse, and a respiratory therapist, and all of them say the same thing. They say they're barely hanging on right now, but say Arizona will run out of ICU capacity in the next few weeks, and an even bigger problem, lack of staff. No sugarcoating. Medical staff in Arizona say the COVID situation in hospitals is getting grim.
About 1 in every 10 persons that gets tested positive is going to end up being admitted to the hospital. I mean, we have, reports from multiple hospitals in the valley that are at capacity. ICUs are at capacity. Some are even over capacity, right? I mean, then they hold in the ER.
Dr. Sam Durrani is the chair of the Honor Health COVID-19 Task Force and says they're meeting virtually several times a week. They know ICUs already have more patients in the winter every year, and now with the second wave of COVID, it's only getting worse. He says hospital surge plans call for more travel nurses, but too many states need those extra hands too.
There's going to be a battle for, good travel nurses, unfortunately.
Dr. Frank Lavecchio is an emergency medicine doctor for both Valley-Wise and Banner hospitals.
So far, we're doing okay. Would I say we have an abundance of beds? Absolutely not.
But the concern goes beyond just the doctors. I spoke with both a nurse and respiratory therapist at local hospitals who asked we keep them anonymous for fear of backlash. The nurse told me in a statement that right now, quote, sometimes 2 COVID patients in one room. They say we have beds and maybe in some overflow areas, but 0 staff to run them. The respiratory therapist saying in part, beds are filling up fast. There is a fair amount of burnout and a fair amount contracting COVID as well. We've had half a dozen respiratory therapists come down with COVID. They all know what's on the horizon, trying to prepare the best they can.
If things stay the same with regard to the available ICU beds, and it keeps going up, obviously we're going to run out of beds.
Both doctors I spoke to say if capacity issues continue to get worse, the first things to go would be elective surgeries, especially those where patients have to stay in the ICU for part of them. But those can be really critical surgeries for many, so they're hoping we don't have to get to that point. Reporting live in Scottsdale tonight, Brianna Whitney for Arizona's Family.